Hi everyone, welcome to the condition presentation about neurocognitive disorder due to a traumatic brain injury. My name is Jennifer Valdez and I am student A in this presentation and will present an overview of traumatic brain injury according to the DSM-5. Student B will be Maura Singer. A traumatic brain injury is often referred to as a TBI. It's defined as an impact to the head that is caused by an external physical force. It's something that can happen to anyone and can occur anywhere. Within the DSM-5, a traumatic brain injury needs to include one of the following. Did the person lose consciousness? And if so, for how long? Did the person suffer from any amnesia after the fact? Does the person show signs of disorientation or confusion? And what type of neurological signs is the person displaying? Symptoms will show immediately after the traumatic event happens. A traumatic brain injury can look very different to each individual as our brains all have different connections and functionings. The healing process is very different than a person with a broken bone. Symptoms have to arise immediately after the impact and can persist past an acute recovery period. A traumatic brain injury is classified as mild, moderate, or severe. A mild traumatic brain injury is often referred to as a concussion, and it results in a brief change in one's mental status or consciousness. A mild TBI can recover within days to weeks and last no more than typically 3 months, whereas a severe traumatic brain injury can last for an extended period of time. The severity depends on one's amount of time they have been unconscious. So for a person who has had a mild traumatic brain injury, they may have lost consciousness for a few minutes or for a few seconds. A person with a moderate traumatic brain injury would have lost consciousness for anywhere between an hour to 24 hours. And a person with a severe traumatic brain injury would have lost consciousness for more than 24 hours or possibly would have been in a coma. When we think of someone suffering from amnesia after the event, we think of the individual that they can't remember significant events that have happened in their lives. They may not remember the event that led up to the injury. They may not remember their names or even where they're at. Some other neurological signs that they may display are either the onset of seizures or an increase in seizures if they previously had epilepsy. They also may display things such as diminished sense of vision or smell, and the results of their neuroimaging may possibly show signs of bleeding. Each individual suffering from a traumatic brain injury will experience different and varying signs and symptoms. One of them is mood lability, which may change, and you may see changes with frustration tolerance, irritability, or increased tension and anxiety. One's personality may change to include aggression, lack of a desire to do past events, or increased suspicion of others. Some somatic symptoms one may experience are headaches, fatigue, sensitivity to light, sleep disturbances, dizziness, and reduced tolerance to psychotropic medication. Neurological signs one may develop are seizures, orthopedic, and visual issues. After suffering from a traumatic brain injury, individuals are at risk of developing depression or anxiety or other neurodegenerative disorders such as Alzheimer's. An individual with a severe traumatic brain injury may have difficulty completing their own activities of daily living and may require assistance to live independently, or they may develop severe neuromotor difficulties. This slide is just a brief overview of risk factors associated with traumatic brain injury. Again, a traumatic brain injury can happen to anyone and anywhere, but they are most common with children who are under the age of 4 or adults that are over than 65. The reason for these two populations having a high risk are due to they are more prone to falls, which is the leading cause of a traumatic brain injury. A common reason that an adolescent might sustain a traumatic brain injury is due to a sport-related activity. And one might think of football as well as the amount of concussions an athlete might sustain. Other factors and risk factors leading to a traumatic brain injury could include motor vehicle accidents, being struck by or into an object, and someone that has tried to attempt suicide. This last slide is a link to a video that I felt gave a comprehensive overview of a traumatic brain injury. Do apologize for the dry humor within the video, but I thought it did give a good description of traumatic brain injury and also with the functions within our brain that can be effective. Thanks for listening, everybody.